Hi, Dr. Wazen. Can you tell me why I have a runny nose?
Okay, so a runny nose is a symptom of a couple of things. People could have a runny nose because of allergies. So that's usually a runny nose with sneezing, itchy eyes, and so on, typical allergic symptoms. But that's not always the case. So if you have a runny nose and we check and test you for allergies and all is clear, there is another condition called chronic rhinitis, non-allergic rhinitis. Another name for it is vasomotor rhinitis. And these are conditions of the nose where you have excessive mucus formation, a runny nose, without being triggered by an external allergic reason. So people with chronic non-allergic rhinitis could have a trigger of a runny nose, for instance, if and when they eat. So, and it doesn't matter what they eat. So it's not an allergy. It's just the mere fact of eating that triggers that runny nose. They have to blow their nose constantly, and sometimes it could be very annoying, and to some people very embarrassing because they always need to clear their nose if they're out to dinner and so on. But it's not always with eating. It could be just walking outside, seeing the sunshine, and then the nose would start running. And there are other examples of why or reasons to trigger that nasal discharge. So because this is not allergic, the typical allergic medications do not work as well with the chronic rhinitis. But fortunately, for people who have not responded to nasal sprays and antihistamines and so on, we have a new tool now that freezes the nerve that creates this nasal discharge in the back of the nose. So in an easy procedure under local anesthesia, we place that little wand through the nose to the back of the nose under direct vision with this endoscope. And we turn the freezing gas on, and that freezes that spot where the nerve comes into the nasal cavities that stimulates and creates that nasal discharge. It takes about 30 seconds per site, and once it's done, the chances of that eliminating the nasal discharge is about 70–75%. So it works well for the right reasons.
Great. Is this covered by insurance?
It is. It is covered by insurance. And as I said, it's outpatients done in the office, so you don't need hospitalizations and all of that.
What's the best way to get in contact to schedule an appointment?
So you could just call us or visit our website, and you will be scheduled with any one of us who could handle this situation. We will evaluate your nose. We will make sure that there is no polyps, there's no deviation, there's no pathology inside your nose. We may or may not need to test for allergies, and then we will treat you in the appropriate way for your condition. So not everybody who has a runny nose has the same condition, so we have to reach the correct diagnosis so we could offer the correct treatment.
Thank you so much, Dr. Wazen.
You're welcome.